Here we go again. These questions are a little better. Okay, true or false? The nursing progress begins with planning. Well, we had this question last time, and we know what it always starts with. The nursing process always starts with, I should not rub my head against this pillow, inspection. So you're gonna, you're assessing. You need to inspect. Then you palpitate. Wait, no. That's something else. What is this? Oh yeah. Yeah. Okay. It begins with assessment. I don't know why I said that. That's a whole different thing. Oh, 'cause inspection. No, it is. It does start with inspection on the other one. It goes inspection, palpitation, percussion, auscultation. What a great way to start this video off. But yes, the nursing process begins with assessment, not planning. Assessment. Oh my god, I actually don't remember it. At the top. Assessment, diagnosis, outcome, planning, implementation, evaluation. Right? I don't. Fuck it. It doesn't matter. It actually doesn't. Look at my YouTube getting exposed. Okay, which is the best example of subjective data? What is subjective data? Subjective data cannot be proven. It comes from the patient's mouth. B. Patient reports nausea. Respiratory rate, that's objective. Temperature, objective. VSAT, SpO2 stat, objective. Okay, what type of assessment is used when admitting a patient to the hospital for the first time? You've never seen this patient before. You need to figure out all their issues. Are you going to do a follow-up? No. We had that example last time from pneumonia. Shift assessment. Well, they're getting admitted for the first time. Screening. Are you trying to, prevent them from getting something they might be predisposed to? No. So that only leaves comprehensive. You're going to do the whole thing, head to toe, in between the toes, in between the fingers, all the little in between the skin folds. You're getting everything. You know what I'm saying. I'm exaggerating. True or false, closed-ended questions are the best way to begin a health history interview. Okay. Why are you here? Or should you say, or what brings you in today? Or should you say, are you having problems? Yes or no? You're playing the freaking Ben game. Ben? Yes. No. Please understand that one. Come on, you guys are like so young. Okay. But no, yes, no. This is false. You should start with open-ended questions. An open-ended question would be, what brings you in here today? Closed-ended would be yes or no. Which temperature route is least accurate for core temp? Rectal. No, that's most accurate. Oral. How accurate? Pretty fucking accurate. Forehead. No. Armpit. Axillary. I mean, that's just gotta be self-explanatory. Percussion note that is flat, that is most likely heard over which structure? Well, let's think about this. Normal lung tissue. No. You literally, if you ever pat a dog, you can hear, big dog, you can hear when you're over your lungs, and you can hear when you're over, the rest of their organs. So, no, not lungs. Lungs sound hollow. Stomach. I mean, yes, I guess. But out of these things, the thigh muscle, the stomach, and the small intestines, what is the most dense? What is going to give you the most flat sound? I hope you guys can hear that. I'm just smacking the shit out of myself. It's thigh muscle. You're most dense there. Auscultation technique should always be performed immediately after palpitation. This is what I was talking about. Yes, okay. It goes inspection, palpitation, percussion, auscultation. So think about it. Okay. Ooh, my stomach is hurting. Okay. Let me look at your stomach. No visible wounds. Okay, I'm gonna feel your stomach. Does that hurt when I press on your stomach? No? Okay. Let me tap on it. Can I hear anything? Can't hear anything. Okay, well let me listen to your bowel sounds with my stethoscope. Okay. So no, auscultation is not after palpitation because you're gonna say your problem, they're gonna look at it, then they're gonna feel it, then they're gonna see if they can hear a sound, if they can hear a sound, if you could hear a sound, not with the stethoscope, and then they're gonna listen with the stethoscope. Okay, which blood pressure reading is considered stage 2 hypertension? 118/76, 128/82, one goopy go away, 140/90, or 162/102. Well, stage 2, let's think of stage 1. I don't know stage 1, but it's probably just over. I think it's actually in between I think it's 121 to 139. So then you're going to have to go over, if you're in stage 2, you're going to have to be in the 140s minimum, but your diastolic is still with that 142 in the 90s. So you probably want to have a pretty high diastolic. So what option do we have left where we're over 140 and we are over 90? D. Stage 2. See how my brain got there? Which finding would be most concerning during a skin exam? Symmetrical mole, brown macule with irregular borders and color variation, pink warm skin, or nail bed with a capillary refill of less than 2 seconds. Yes, that's right. That hits A, B, C, D, E. What does that stand for? Asymmetry. Kind of irregular. Borders, irregular borders. Color, that color is varying. Diameter, and elevated. We don't have A, D, and E, but we have B and C. Osteoporosis, oh my god. Osteoporosis prevention includes weight-bearing exercise and calcium and vitamin D intake. Yes, it does. Think about your bones. You want to prevent your bones from being brittle, what are you going to do? You're going to work out, you're going to increase the weight bearingness of your bones, and you're going to do things that support your bone health. So you're going to have high calcium intake and high vitamin D intake. Which communication behavior demonstrates active listening, looking around the room, nodding and summarizing, infrequently interrupting, interrupting a lot, or using medical terminology? Okay, we're not dumb here. We know it's nodding and summarizing. Hyperresonant percussion is a normal finding in a child's lung, is it? Or, okay, let's go through the sounds. What is resonant? Yes, it's lung sounds. What is tympanic? Yes, it's over the stomach. What is hyperresonant? It is an abnormal, mass, or it's just an abnormal thing. It doesn't sound right. It's something that's not supposed to be there. Okay, which body system is assessed during the Braden scale? We're not going to be asked this on the test. 100% no. It's integumentary. It's skin, so it's not any of the other three, and we had a whole those are all your epithelial cells. Okay, which lesion is an example of primary ulcer, erosion, macular fissure? Well, all these things break the skin, kind of. And you should just know. Macule is primary. Moist mucosal membranes are a normal hydration finding. If your body has excess water, you're probably going to be pretty moist. Okay, I'm going to skip this one. Which respiratory pattern is characterized by deep breathing followed by apnea? I don't even know why it put this question in there. If you remember it, it's from Patho. It's Shane Stokes. It's that. And Shane Stokes is also uneven. But whatever. Which is the most accurate pulse site for assessing circulation on the foot? I don't think we're going to need to know this either because we haven't really touched anybody's feet. But it's your pedal pulse, it's your dorsal, it's the top of your foot. Dorsal, pedal, pedis, pedal, top of foot. Older adults have decreased skin elasticity and increased risk of pressure injuries. Obviously. They have less elastic fibers and collagen. That's why they get wrinkly and saggy. And increased pressure injury, I mean, it's almost like we have an entire PDF just dedicated to how to rate people's risk for pressure injuries. Okay, which lab result would be most concerning? Hematocrit at 42%, a fasting glucose at 160, your cholesterol at 180, and a hemoglobin at 15. Well, if you remember from the last video, what should hemoglobin be at? Between male and female, it ranges from 12 to 18. So for both of them, we're in there. It's 12 on the low end for girls and 14 on the low end for guys. Okay, cholesterol. I know we haven't gone over this, but cholesterol should be at less than 200. The risk that it would put you at if you were over that is obviously a vascular disease of some manner. You're going to get, like lipids are going to get caught up in your veins. That's called plaque. We know this. We remember this from patho. Hematocrit at 42%. I actually don't remember the values. I know where they are, though. I think they're actually the very last thing. Yeah. Hematocrit values are 42 to 52%. So, you know, right under 50%. Which you're in there. 42 to 50%. You're right on the low end. Or right on the end of being normal. Okay, fasting glucose. This one should stand out to you. Why? Because the normal range for glucose is 70 to 105. Some things will say 60, some things will say 100, some things will say 110. This book says 70 to 105, just know that one. But obviously, in any case, 160 is high. As someone who's not diabetic, you should not be here. I mean, diabetic people shouldn't be here either, but they can't really help it. Okay, which finding would indicate iron deficiency anemia? We should remember this. Jaundice, dry skin, and delayed wound healing. Brittle hair and easy bruising. I mean, yes. Yes. Let me make sure, actually, that it's the one. I mean, I know it's that one, but I don't know. Brittle hair and easy bruising. That's like an iron deficiency thing, isn't it? But anyways, it's A. Spoon-shaped nails should pop out to you. I don't know what glossitis is. Let's learn what glossitis is. Glossitis. Inflammation of the tongue. What the fuck? Okay. Yeah, no, this definitely is not on the test. I think it's because one of the osteoporosis symptoms is something to do with the cranial nerve. Uh, really, really weird. It was, oh God. Yeah. In arthritis, you can have issues with your cranial nerve, which is number 11. Don't actually ask me at all what it is. I have no idea. But yeah, I mean, facial symmetry, I'm gonna go with it would be facial. It doesn't matter. Like, literally ignore that. Forget that completely. Which is the most reliable method for confirming abnormal blood pressure? Only take the reading once, recheck manually after 5 minutes, estimate by palpating, and ask if dizzy. I mean, come on, guys. Obviously. Recheck manually after 5 minutes. Which musculoskeletal assessment is finding is considered abnormal? Full range of motion, strength graded 5 out of 5, gait steady, or an unilateral muscle atrophy. I mean, come on, we're not stupid. It thinks we're dumb by giving us these easy ass questions. Obviously, it's the atrophy of one side. Purulent, whoa. Pustules containing purulent materials are commonly seen in acne. Well, let's think about it. What does purulent mean? Yellow, greenish, discharge. Okay. Pus, if you will. A pustule. A lesion containing pus. What do zits have? I would say they're lesions containing pus. Yes, true. We do not need to know this, but it's above 30. It's actually got to be 36 if you want to get Ozempic covered by insurance. Which assessment technique is most appropriate for detecting high-pitched bowel sounds? Same thing with this. I don't know why it put this in there. I just knew this one. Okay, increased thoracic kyphosis is a common change in older adults. It loves this fucking question. Loves to give me this question. Yes. I mean, sure. And then once again, we didn't learn anything about rickets, but I think it's vitamin D? Is it vitamin D? Is rickets? Yeah, vitamin D. Who knew? And then we're back to it. Which abnormal skin finding follows the ABCD of warning signs for melanoma? Symmetrical mole, uniform, less than 6 millimeters, round macule, even borders, irregular borders, multiple colors greater than 6 millimeters, or a freckle that remained unchanged. Clearly, it's this one. We're hitting borders, we're hitting color, and we're hitting E, which I thought was elevation, but now it kind of could be size. I'm not really sure. But yes,